She told me mask off, yeah. Yeah. Someone did the research. Usually the mic is way too tall.
So, hey, Premier, I'm CBC, Jordan, CTV, and we is Canadian Press. We all have questions.
Hey, guys.
Jordan's taking it away.
Fire away.
Hi, Premier. Did you have any conversations today with the Prime Minister about the Muskrat Falls and financing deal?
We certainly did, and we're both satisfied that the AIP is progressing towards completion. He reconfirmed his commitment to the deal that was announced in July.
And will that deal be finalized by the end of this year? My understanding that it was agreed in principle, but it has not been finalized yet.
The two teams are still working through the exact mechanics of the deal itself. Not different than any other deal once you announce an agreement in principle, but we're quite satisfied that they are progressing and that this is the commitment will be honored in full.
Hi, Premier. Chris
Yeah.
from CBC, and I'm basically asking for
Sure.
St. John's. So consider me St. Peter Cowan's voice or Anthony Trevino or whatever. So cyberattack, it's been a month since the hackers took over the system. Most details have been kept secret, probably for a lot of reasons, but is the attack over, and did you pay a ransom?
Look, we've been very careful in the language that we've selected around the attack, and we will continue to be so. I know everyone wants answers immediately, but you can anticipate the consequences of some inappropriate language. What we are satisfied to say is that the systems are being restored. Operations are happening. There's some disruption, but patients are getting the care that they need right now. And there's still an ongoing RCMP investigation. I'm not going to comment any further at this time.
I would just ask you, because you've met with the Prime Minister,
Yeah.
the Centre for Cybersecurity, the Communications
Yep.
Security Establishment is all sort of part of the federal apparatus. Was that part of your discussions with the Prime Minister?
Absolutely was. First and foremost, I thanked him for the support that they provided. And there has been the CSC team on the ground helping the province from the beginning. We do believe that this is a provincial security issue, and that's why we're not commenting, frankly, extensively publicly about it, and that's the advice that we've been giving. But we're certainly happy with the support that we've had from the federal government, whether it's through the systems and structure itself of CSC, but also the Department of Defense, Minister Blair, Minister O'Regan, everybody, Minister LeBlanc, everybody has been supportive in trying to help us navigate through this, because I think everyone recognizes that, although we may be one of the first, this is an ongoing issue in 2021, 2022, and beyond.
I just ask one last question and hand over to
Sure.
You're a physician, your wife's a physician.
Yep.
What are you able to tell her and her, all part of your social circle of healthcare people about where things stand with the
I don't tell them anything. I don't tell people into the mic, but I will tell you that I have been, as I've maintained the whole time, keeping my hours. So I do have some interaction with the hospital itself and with colleagues and nurses and patients. And the system has been restored to a certain level that is appropriate to provide ongoing acute and chronic care. And that's the kind of detail that I've been discussing with my colleagues. With respect to any kind of disclosures about patient-specific information, that falls to the Regional Health Authority, and I'm confident that they will work their way through this and have a plan in place when the time is right.
If I could just follow up on that.
Sure.
The cyber attack. You spoke about consequences earlier. You can imagine these. I frankly don't know what consequences you're talking about. Can you elaborate on that? Like, why can't you say more? And are you?
Well, this is fairly.
The perpetrators are still monitoring you guys.
Pardon me?
That the perpetrators are still watching you, are still monitoring you.
So, I mean, I think every Canadian, frankly, should be cognizant of the fact that somebody could be monitoring you in 2021, and I would hope that every Canadian is doing their part to prevent their own cyber attack. As individuals and as systems. This is a wake-up call for not just Newfoundland and Labrador, but for all jurisdictions and touches, frankly, all businesses, all individuals across the country. I mean, the same week that the issue occurred with us, the FBI was hacked, if you recall, and there was 100,000 emails sent out from an FBI server. So, this is not a specific problem to Newfoundland and Labrador. This is a general problem that we all need to be cognizant of, and with respect to the consequences, they have to do with individual privacy issues and security issues from a provincial standpoint.
I guess I think a lot of people are still confused, and
Well, it's fairly straightforward, actually. It shouldn't be confusing. You know, this is a security issue that we can't really comment on at this time, and there is still an ongoing RCMP investigation into the issue.
Even though people's, you know, I guess a lot of people are wondering what's their personal information.
Yeah, no, but to be fair, what I've said is, and what the regional health authorities have said is, they will disclose that in due time once they have. This is still an ongoing issue, and they will, once they have that information, they will reveal it. I mean, we were very public about this from the beginning. Did a full mass disclosure that this was an issue. Never shied away from it. So people are on alert. And you know, as the issue is sorted and the investigation unfolds, individuals, either collectively or specifically, will be notified if it's appropriate.
We have time for one more question, if anyone has one.
I guess maybe just the follow-up, is the attack still going on? Are you still under attack right now?
Are we still under attack right now? I mean, again, I have to be very careful about the nuance of what we say, but the system is up and running, and we have, with the whole support of the federal government, been doing our best to ensure that the system is robust, safe, and confident for the providers, specifically with the healthcare.
Anything else we missed? Any other news you want to make?
Yeah, I would, no, not at all, but I would say this, you know, I've talked to all the other premiers about this as well. This is not, be very clear, it's not a Newfoundland and Labrador problem. This is a problem that touches all jurisdictions and will touch all jurisdictions at some point in the not too distant future. And as good as your systems can be, there is someone who will potentially be a bit better, as we've seen with the FBI just last week. Planned Parenthood in the United States had 400,000 patients with their data stolen. Like, this is a new modern crime, and I think the fact that the federal government rallied to support us, you know, that's the realization for them that this is more than just an individual provincial issue. This is a bit of a national issue, and the more we can work together, as we had in this case, to come together to further this defense, then I think that's the approach that we should all incorporate moving forward.
Thank you for your time.
Thanks very much.
Thanks very much, everyone. Take care.
Safe trip home. Stay dry.